A lot of different drugs are being studied in the phase 3 clinical trials in the newly diagnosed setting, including for patients with myeloma who are not eligible to go through a stem cell transplant. So historically, we have used a melphalan-based approach for most of these patients because the melphalan prednisone combination is the backbone to which many of the new medications have been added. What has changed over time is, one, the appreciation of who is really transplant eligible versus not eligible, and that has evolved over time. Instead of just basing it on age alone, we are factoring in a variety of other factors, including the frailty, what the patient really wants to do, whether they desire a transplant or not, and all those things get factored in. So increasingly what's happening is the choice of therapy for the newly diagnosed myeloma is starting to look more and more identical for patients who are transplant eligible and ineligible, because we can use the same drugs. We can use it, and increasingly we use combinations, at least a 3-drug combination, if not 4, as the new trials start showing benefit for the 4 drugs. Now, what we have learned is that these older patients, even if they are a little bit more on the frail side, they are often able to tolerate the same number of drugs. It's just that we have to use less of the drugs. So the same combinations still apply to those patients, increasingly so.